Welcome to iRounds, the most comprehensive mobile and web platform for physicians. With iRounds, you can communicate with one another, share call schedules, follow appointments, and allow cross-coverage between groups of physicians you already cross-cover for. For the first time ever, iRounds gives physicians a mobile patient sign-out application. So how will iRounds help you? It enables physicians to keep live, real-time census of their patients, call schedules, surgical schedules, and the ability to communicate with one another in real time. The strength of this application is communication over a secure, cryptic, HIPAA-compliant server. Your data will always be safe, allowing members a means of secure communication regarding patients and secure means of consulting with one another regarding the care of those patients. Begin by registering on the website. By doing so, the administrative staff at the physician's office can enter pertinent patient information and schedule surgical procedures. To register, enter your first and last name, email address, phone number, and group type and name. Once registered, you will receive a welcome email that will include a system-generated password. Follow the directions in the email to activate your group. Enter your email and the unique password. Once logged in, you can change your password to one you are going to remember. This will be the password you use to log into your app. iRounds mobile app can be downloaded from iTunes or from iRounds.net. The app is used in conjunction with the website. Once you've downloaded the iRounds app to your mobile device, log in using the email address and password you used when registering on the iRounds website. Once you do that, you will be asked to enter a passcode only you know, then re-enter that passcode to confirm it. Your web and mobile platforms are now ready to work hand in hand. Now let's take a look at how you can get the most out of iRounds. On the website, you will see your on-call doctor list and schedule. Click on Provider and add the providers in your practice. When you send them an email, they will receive a confirmation email asking them to join and to activate their account. If you want your particular physician to have administrative access, click the Group Admin box. Once they activate, they can be added to the on-call schedule. If a physician leaves a practice, you can make them inactive and they would no longer have access. On the iRounds app, you will find the doctors that you added on the website. There is an MD to MD feature, which allows you to chat with the doctors with whom you're connected within iRounds. Once providers are activated, you can add your hospitals. You can use the full name, but there is a box to use an abbreviation, which will make it easier for you to delineate which hospitals you're using on the app. Once the hospitals are active, you'll be able to see them on the app. Under the Patient tab, your administrative staff will be able to add patient information including scheduling C-sections, inductions, deliveries, and surgeries. You can enter their name, the hospital where they will have their procedure, and whether they will be an OB or a GYN patient. For OB patients, you can select the type of procedure they will undergo, their LMP, and their due date. You can also keep track of their Gs and Ps, indicate whether they are GBS positive, and enter any other pertinent information. For a GYN patient who may be having a procedure at a different hospital, you can schedule the type of procedure, enter the date of surgery, as well as the surgeon performing the operation. All other pertinent information can be filled out by the physician. Once a patient is discharged, your office staff can click Discharged and see a list of patients that have been discharged. You can add patients using the app as well, simply adding the information just as you did on the iRounds website. Also, the patients you entered using the website will show up on your app as well, with all of the pertinent information related to that patient, including at which hospital she is a patient and what procedure she is scheduled to undergo. You can also update or change any of the information related to that patient. If you wish to add a patient, simply click on Schedule, find their name, slide over the green arrow, and tap Admit. Also, once a patient is ready for discharge, you can also discharge them using the iRounds app by sliding over the green arrow and tap Discharge. On the website, under the Schedule tab, you see a month view, a week view, and a day view. You can add someone to the schedule under a general appointment, such as a staff meeting or a department meeting. Patient appointments can be booked as well. If it's a patient already on your census, you can just add them. If they're not on your census, you simply add a new patient, entering their information. Once that's complete, click on the patient to add them. Select the physician's name, save the page, and they're on the schedule. You can then adjust the length of the appointment or move the appointment to another time. Whatever patient you enter into the system will then appear on your iRounds app, where you can also find which doctor is on call when. The iRounds cross-cover feature on the website and the app gives you an opportunity to allow another group in town to have access temporarily to your patient list. If you request for group access, you must have their group name. You can add that group and save them. That group will get a request in an email and will determine if access will be granted. If it is, that will show up in this space. iRounds was founded to enhance a physician's ability to communicate with their colleagues in a secure and HIPAA-compliant format. A company founded by physicians for physicians, iRounds will add to our online and mobile presence with the ideal that seamless patient care is excellent patient care.